Her name was Bella, 7 years old, a golden retriever, the kind of dog that greets strangers like long-lost family, tail moving so fast it sounds like a helicopter blade. Her owner, a woman named Sandra, brought her in for what she thought was a routine wellness visit. Sandra fed Bella what she described as the good stuff. Premium Kibble, brand she'd used for 6 years, the one with the green bag and the veterinarian recommendation stamp on the front. She brushed Bella's teeth twice a week. She gave her dental chews every night before bed. By every measure Sandra knew about, she was doing everything right. I opened Bella's mouth during that exam, and I stopped talking mid-sentence. The molars, the teeth in the back, the ones owners never see because they require a full lip retraction and a very specific angle, were coated in brown calculus so thick it had begun separating from the gum line. Not just tartar. Calculus. That's the mineralized version. Think of it like limestone that has calcified onto the tooth over months or years. Underneath it, the tissue was pulling away from the root. Bella had stage 3 periodontal disease, which means active bone loss around 4 of her rear teeth. Those teeth were already loose. 2 of them I could not save. Sandra sat in the waiting room during the procedure with Bella's leash in her lap. When I came out to speak with her, her first question wasn't about the cost or the recovery, it was, "How did I miss this?" The honest answer I gave her was this: she didn't miss it. Nobody showed her where to look. And the food she trusted for 6 years had a role in this that nobody had explained to her, not because it was poison, but because of a mechanism that almost no one talks about outside of dental veterinary conferences. That mechanism is what I'm going to explain today, and by the time I've finished, you'll know exactly what to look for in your dog's mouth tonight and exactly what your dog's food is, or isn't, doing to their teeth. Because here's what I see in my clinic almost every week. Owners who love their dogs deeply, who read labels carefully, who make considered choices, and who are completely unaware that the food debate they've been watching online is missing the single most important question. Not which food is healthiest in general, but what each food is doing inside your dog's mouth every single day, at every single meal. The answer is not what most people expect, and it changes everything. Let me explain what's actually happening in your dog's mouth, because most people imagine dental disease as a simple build-up problem. Food gets stuck, tartar forms, you brush it away. That's not the full picture, and understanding what's actually happening will make the rest of this much clearer. Your dog's mouth is home to somewhere between 350 and 500 species of bacteria at any given moment. Most of them are harmless, but within 24 hours of a meal, a very specific subset of those bacteria begin producing something called a biofilm, a thin, sticky layer that adheres to the tooth surface. You know this as plaque. Think of plaque like the algae that forms on the glass inside a fish tank when you leave it too long. It starts invisible. It's soft. You can wipe it off with your finger if you catch it early enough. The problem is what happens when plaque is not disrupted. Within 72 hours, minerals from saliva, calcium, phosphate, begin to crystallize into that biofilm. The soft film hardens. It calcifies. Now it's calculus, the mineralized deposit I found on Bella's teeth. And, unlike plaque, you cannot brush calculus away. It has to be removed by a vet under anesthesia with an ultrasonic scaler, the same way a human hygienist scales teeth during a cleaning. Now here's where the food angle enters the picture. Different foods change the oral environment in completely different ways. The pH level of saliva, the amount of fermentable carbohydrates available to bacteria, whether the chewing action mechanically disrupts plaque or does nothing at all. And the 3 food categories I get asked about most, raw, kibble, and fresh cooked food, each interact with this mechanism differently. Not one of them is a perfect answer. But one of them has a significant mechanical advantage that almost nobody talks about, and one of them has a carbohydrate problem that the industry has spent considerable effort downplaying. Your vet isn't wrong to recommend kibble. Most of what they were taught in school about nutrition is correct, but dental physiology is its own specialty. It's not standard in most veterinary school curricula, and most practicing vets don't have 20 minutes per appointment to walk through the biochemistry of oral biofilm formation. That's not a criticism. That's just the reality of how veterinary care works in practice. I've spent 22 years as a veterinary internal medicine specialist. I've operated on thousands of animals. I've held animals in the final moments of their lives and watched owners process grief in the waiting room, grief that might have been postponed by years if someone had told them one specific thing earlier. Every time I close a chart on a case like that, I ask myself the same question: how did it get this far? The answer, more often than not, was not negligence. It was incomplete information delivered too late. That's why I do this. When you get home tonight, I want you to do something specific. Walk over to your dog, ask them to sit, and gently pull back the upper lip on the right side of their mouth. Not the front teeth, the side teeth, the carnassials. That's the large shearing tooth about halfway back, the one that looks like a small triangle. Run your fingertip along the gum line. If you feel anything rough or sandy, that's calculus forming. If the tissue looks swollen or red, right at the edge where tooth meets gum, that's gingivitis, the first stage of periodontal disease. Most owners have never looked at this specific tooth. Most owners are surprised by what they find. Now, let's talk about what your dog's food has to do with what you just felt. Kibble is the food most people feed, and the assumption most kibble companies have cultivated for decades is that dry food cleans teeth better than wet food because chewing creates friction. Some kibble brands take this further with a specific dental formula. Larger kibble pieces designed to require more chewing, sometimes with a fiber matrix that's supposed to wipe the tooth surface as the dog bites through. The Veterinary Oral Health Council, which I'll call VOHA, has a list of products that have passed clinical trials for plaque or calculus reduction. Some kibble is on that list. Most kibble is not. Here's the problem with the friction argument for standard kibble. Dogs don't chew most kibble the way the marketing assumes. They crack it and swallow it. A 2016 study published in the Journal of Veterinary Dentistry measured chewing duration across food types and found that most dogs consuming standard-sized kibble spend less than a second per piece before swallowing. At that contact time, the mechanical cleaning effect is close to zero. And every piece of kibble contains fermentable carbohydrates, starches from potato, corn, rice, wheat, which are exactly what the bacteria responsible for early plaque formation consume. You are not cleaning the teeth with the kibble. You are, in some respects, feeding the biofilm. I had a patient, a 5-year-old border collie named Remy, whose owner switched from standard kibble to a VOHA-approved dental kibble. Not a brand change for marketing reasons. A deliberate switch to a product that had clinical trial data behind it. At Remy's next dental exam, 8 months later, calculus accumulation on his carnassial teeth had dropped measurably. The owner hadn't changed anything else. Same water bowl, same treats, same brushing routine. The kibble formulation was the only variable. That matters. But it only tells half the story because dental kibble is still kibble. Still carbohydrate-based, still not disrupting plaque the way a raw bone does. Have you ever looked at the first 5 ingredients on your dog's kibble bag? Tell me in the comments what the first starch is: corn, potato, peas, rice. I'm curious how many of you are feeding something you assumed was mostly meat that is actually mostly carbohydrate by ingredient weight. Raw feeding is where the dental conversation gets genuinely complicated, and I want to be honest with you about what the evidence shows, not what raw feeding advocates claim, and not what kibble defenders claim. Both sides have a financial or philosophical investment in their position. I have neither. The mechanical advantage of raw feeding is real. When a dog chews a raw, meaty bone, a chicken neck, a duck wing, a beef rib, the chewing action is sustained, involves the full carnassial tooth, and the fibrous connective tissue of the meat acts like a natural dental cloth along the gum line. Studies comparing dogs fed raw diets with whole bones to dogs fed processed diets consistently show lower calculus scores on the carnassial teeth. A study published in PLOS 1 in 2020 found that dogs fed raw meaty bones had significantly less calculus than dogs fed commercial dry food, with the difference most pronounced on the large shearing teeth in the back. That is not a fringe finding. It replicates across multiple studies. The risks are also real, and I am not going to minimize them. Raw meat carries bacterial contamination, salmonella, listeria, E. coli, that poses a genuine risk both to the dog and to the humans in the household who handle the food, the bowls, and the floors. Bone fractures are a documented hazard, particularly with weight-bearing bones like femurs, which can crack carnassial teeth rather than clean them. Nutritional imbalance in homemade raw diets is extremely common. I've seen raw-fed dogs with calcium to phosphorus ratios so far out of range they were developing metabolic bone disease. And none of this is offset by the dental benefit alone. A fractured carnassial tooth is a dental emergency that costs more to treat than a year of annual cleanings. I'm not telling you not to feed raw. I'm telling you that the dental benefit is real, the risks are real, and the most responsible raw feeding requires working with a veterinary nutritionist, not a Facebook group, to formulate a diet that is actually complete and safe. If you're already feeding raw and doing it carefully with professional guidance, your dog's teeth are probably cleaner than average. That's worth knowing. Fresh cooked food, the category that includes commercial brands like Farmer's Dog, Ollie, and similar subscription services, as well as home-cooked meals prepared with veterinary nutritionist guidance, sits in the middle of this picture. And it's the category I get the most questions about because it's the fastest-growing segment of the pet food market right now. From a dental standpoint, fresh cooked food has no mechanical cleaning action at all. It's soft, it doesn't require sustained chewing, and dogs typically lap or gulp it rather than shearing through it. What fresh food does have in its favor is usually a lower carbohydrate load than kibble, because most fresh food formulas are protein-forward with vegetables rather than grain-forward. Lower fermentable carbohydrate availability in the oral environment means somewhat less bacterial fuel for early plaque formation. The difference is not dramatic, but it's real. A 9-year-old Labrador mix named Winston came through my clinic 2 years ago, switched to a fresh food subscription diet by his owner who was trying to manage his arthritis through diet. Winston's owner was meticulous, added dental water additives, brushed twice a week, came in for professional cleanings every year. At Winston's most recent exam, his periodontal status was significantly better than his breed average for his age. Was it the fresh food alone? No. It was the combination of lower carbohydrates, consistent brushing, and annual cleanings. But the food was part of an environment that made the other efforts actually work. The practical takeaway for fresh food: it's not going to clean your dog's teeth on its own, and if you're not supplementing with something that creates mechanical disruption, a dental chew that's on the VOHA approved list, consistent brushing, or dental water additives with proven efficacy, you're missing the most important part of the equation. If you have a dog currently on fresh food and you've never added a VOHA-approved dental chew to their daily routine, I want you to write that down right now as tonight's action. Not a pig ear, not a rawhide, a product that has actually been tested and shown to reduce plaque or calculus. The VOHA website lists every approved product by category. I'll put the link in the description. Now here's where it gets interesting, because the thing almost nobody says is this: the food debate is almost secondary to one variable that matters more than all of them combined, and that variable is mechanical disruption frequency. Think of plaque like that algae on the fish tank glass. If you wipe it every 24 to 48 hours before it has a chance to mineralize, it never becomes calculus. The food you're using either makes that job easier or harder, but it does not replace the job. Raw meaty bones do it well if done correctly. VOHA dental kibble does it partially. Fresh food does not do it at all. Brushing does it best if you do it every 48 hours without fail, because that's the window before plaque begins to harden. Every single thing I've covered today, raw feeding, dental kibble, fresh food, dental chews, works through the same fundamental idea, disrupting that biofilm before it mineralizes. Different doors, all leading to the same room. I want to go back to Bella for a moment because the story didn't end in my operating room. Sandra was devastated after that procedure. 2 teeth extracted, a bill she hadn't anticipated, and the specific grief of feeling like she had failed an animal she loved. But she didn't disappear. She came back 3 months later for Bella's post-procedure recheck, and she'd done something I didn't ask her to do. She'd requested a consultation with one of our veterinary dental specialists, and come out of that appointment with a completely new approach. Switched to a VOHA-approved dental kibble, added brushing every other day. She'd never been able to do daily, but every other day she could sustain, and added a raw chicken neck twice a week under supervision because Bella was a gentle chewer and the specialist assessed her as a good candidate. At Bella's 6-month recheck, the calculus accumulation on her remaining teeth was the lowest I had seen in a dog her age in years. The gum tissue that had been inflamed was pink and tight. Bella still had stage 1 disease, that doesn't reverse, but it had stopped progressing. Sandra said to me before she left that day, "Why didn't anyone tell me this sooner?" And that question stays with me. It's why I make these videos, for the Sandras who are doing everything they think is right and just need someone to point them at the one thing that actually changes the outcome. So here's what I want you to take away. Not a ranked list, not a verdict on which food wins, but a clear understanding of what you're actually managing. If you feed kibble, check whether it's on the VOHA approved list. If it's not, that doesn't mean you need to throw it away tonight, but it does mean you're getting no meaningful dental benefit from the chewing and you need something else doing that mechanical work. A VOHA approved dental chew, a consistent brushing routine, or both. If you feed raw, and you're doing it carefully with nutritional guidance, your dog's teeth are probably getting real mechanical benefit. But get those bones assessed by a vet who can evaluate your dog's tooth structure and chewing style before you assume all bones are equal. If you feed fresh cooked food, and you love it, and your dog is thriving, keep going, but add the mechanical disruption piece. Fresh food alone is not a dental strategy, and regardless of what you feed, pull back that upper lip tonight. Look at the carnassial tooth. Run your finger along the gum line. If what you feel concerns you, schedule a dental exam. Not a wellness visit where the vet glances in the mouth for 4 seconds. An actual dental assessment. In dogs over 5 years old, I recommend one every year, the same way you'd treat any part of the body that is constantly exposed to bacteria. If someone in your life has a dog, a neighbor, a family member, a friend who loves their pet the way you love yours, send them this video. That's all I ask. Everything I've shared today is general information based on current veterinary research and my clinical experience. It is not a replacement for your pet's individual veterinary care. Please speak to your vet before making changes to your dog's diet or supplement routine, especially if your dog has an existing health condition. Your vet is your partner in this, and a conversation with a veterinary dental specialist may be the best investment you make this year.